कि सर पे टोपी है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, कहो सर पे हमारे ताज है, ये चमन हमारा अपना है। समाज है ये चमन हमारा अपना है, इस देश पे अपना राज है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, ये चमन हमारा अपना है।
Okay, so unfortunately we don't have that option here, so we're gonna talk, right? I would appreciate if you have any question, please don't hesitate. We're gonna be having also a separate session for the discussion and if you have any question. But in between whatever I'm saying, if it is not making sense or if you have any question, please don't hesitate to raise your hand and I'm gonna be answering your questions. So as for the here Canada, our location, the clinical location of the Mississauga is 1150 Laurent Park, which is near the Lakeshore West, Unit 7. We do have some like home visits also for the clients who need really help, who are not mobile, because I know it's a senior thing. So we are more flexible on that also. As a team of the Here Canada, we are here to give you a satisfaction that we are going to be providing one of the best services as for the hearing and hearing health checkup. So let's understand what exactly is the hearing loss and why we are talking about this today. So how many of you feel that we should go for the hearing test after 60 years?
Because sometimes we can't hear.
Yes, you can hear. You don't know. Yes.
Younger.
Perfect. So very less people who feel they should go for the annual hearing test, but I do appreciate there are some hands who are really follow up and main concern about the health. I want everyone to be like that, to be honest. It will be the ideal situation. So hearing loss is basically one of the situation which can be encountered by everyone after 60 years of age. So there are so many reasons of hearing loss. So first we will understand, what exactly, how this happened or what kind of a hearing loss we are talking about here. So as per the normal ear, we do have three parts of the ear. Outer ear, that is a canal to the drum. That part is known as a outer ear. Then after drum, to the cochlea, there is one part, the inner ear part. That part known as the middle ear. So middle ear, we have drum, we have three small bones. And one of the smallest bone of the body is present in the ear, which conducts sounds and transfer that sound to the inner ear. So the inner ear basically have two functions. One is for the hearing and another one is the balance. So that inner part have two functions which is responsible for the hearing as well as making a balance. And that part is connected to the brain via cochlear vestibular nerve, that is the nerve which connects the ears to the brain. and send that information to the brain, and that's how we answer the question or response. So that's how a normal physiological process of hearing and anatomy of ear usually. So what happens, there are different, basically 3 types of hearing loss. First is conductive loss, which is basically because of any infection, any trauma, or if you have some wax in your ear, so you might encounter some kind of a partial hearing loss and sometimes ringing. After that, if there is any problem in the middle ear, you will feel some fluid is coming out or there's something going on. So the middle ear, like a mixed hearing loss, and the conductive hearing loss, which is causing because of any infection in the ear or any perforation or a hole in the drum, can be cured by medication or else by surgery. But there's another situation which is age-related hearing loss. That component is known as a sensory neural hearing loss, which is a concern because no medication is there to help that, because it's an aging process. Nobody can stop aging. Do we have anyone who can say that we can stop the aging? No. Because this is a process, normal human nature, and it's a reality. So if the loss is in a sensory neural component because of the aging process, then it's not curable like with the medication or surgeries. The only option for that is either amplification devices or like a hearing aids or cochlear implantation. We don't have anything else. So we're going to be discussing that part also in detail. You would believe that 60% of adults in Canada having a hearing health concern, which includes hearing loss and tinnitus. And what is tinnitus? That is a ringing sensation in the ear. Some say it's ringing, some say it's whistling, some say it's wind sound or noise in the ear. So there's different perception of that. And majority of time, it is more related to the hearing loss. I'm presenting some numbers over here. 50% of adults between 50 to 59 years are having a hearing loss or suffering from some part or some type of hearing loss, which we generally ignore it. So we have to understand, hearing loss doesn't mean that you cannot hear at all. Hearing loss means, if it is more related to the aging process, you're finding difficulties in different situations when there's a background noise. When you watch TV, you have to keep the volume high. You're finding hard to understand your grandchildren's female voices. So those are the situations which we sometimes ignore and we feel, you know what, this is something is going on, that's okay, because it's not life-threatening. But it plays a very, very big impact in your communication lifestyle. So what are the common factors, risk factors of hearing loss? So there are so many reasons for the hearing loss. Aging process, you all know. Noise exposure. The people who work in a noisy environment, such as industries, heavy industries, I would say some work in a factories or music. So those are more prone, or truck drivers, so those are more prone to have a hearing loss. So it is always a good idea to have at least once in a year to have a hearing test. Genetics. It is related to genes like hereditary. Your father must be having some hearing loss, so you are more prone to have a hearing loss. So after 50s, it's a very important thing to have a hearing test. Generally, it's free for seniors. So same like glasses, you do your eye testings, I would request go for the hearing test. It will give you an idea. The other reason could be autotoxic drugs. You have a medical condition like dialysis or kidney problem, or you have some medical things going on. So some medicines are autotoxic, which can lead to the hearing loss because of the reaction of that medicine. But why this happened? Because our main motive at that time to resolve that health condition instead of hearing. So sometimes some drugs, medicines are autotoxic, and that could be also one of the reasons which can cause hearing loss. It could be wax, that is a temporary sometimes, but we feel like the ears is completely plugged and you cannot hear. And then you go to the doctors, your family doctors, audiologists, ear care professionals. Once the wax is removed, you can hear well. Sometimes that's also a condition which is temporary, but makes huge difference. Sometimes you get worried about like, I cannot hear properly. So that is also one of the reasons. And the perforation in the drum, any trauma, infection can lead to that. We already discussed that. So these are the risk factors which affects or which can lead to the hearing loss. Any question till now? So, yes, sir.
As you said,
Yeah.
because of wax, also hearing problem can be there.
Because of wax, yeah.
How to remove that? Because when we talk about the earbuds, they say don't press. Otherwise, that wax will be pushed further inside
That's why
instead of
we-
coming it out.
That's
so
why
what
we
is
are
the
here.
correct method for taking?
So it's always good idea to consult either your family doctor, ear, nose, throat specialist, or any ear care professional who are certified to remove the wax. I strongly recommend to see the professional for wax removal.
You know, I go every year for removal of cells for the specialist and from the family doctor.
Yeah,
So every year I have appointment for that.
that's a good thing. Really appreciate that. We don't recommend anyone to put Q-tips in the ear.
Everybody should go.
Yes. You have questions, sir?
Same thing I was asking.
Get the, sorry, just finish with me. Get the wax removed, injecting water by the doctor is the only way or there are other ways?
Yes,
Get
very
the
good
wax-
question, and thank you so much for that question. So, if the wax is solid, so doctor cannot remove it, they will say put the drops in the ear for 3 days and come back, right? So that's an ideal way. To be honest, what happened, this usually gets solidified in the canal. So once you put the drops in the ear, it will make wax to lose up. And that is easy for professional to remove the wax. Actually, there are 3 methods for wax removal. Water irrigation is a classic way to clean the canal by the professional. That is sometimes discomforting to the clients, but that's one of the best. Then another option is a vacuum to take, we have a vacuum to suck it out the wax and it's clean. And there is another one is a curette method in which we have some stick, we can just take it out the wax, excessive wax in the canal. But those are the 3 standard procedures to remove the wax.
Do you think that hydrogen peroxide is also used?
That is also good, that's a recommended one. Hydrogen peroxide, you can put that and it will clear the wax.
Some kind of oil too.
Well, oil is like that ear, so ear dissolving, to be honest, the ear dissolving drops, the wax dissolving drops is basically a form of oil. And the other thing, the best thing, you can even use the baby oil. But I always recommend to go for the over-the-counter ear wax dissolving drop, which those are standard one. So sometimes what happens if we have something, it might mix with some bacteria, can cause any infection, which is very rare, but still I want to be more professional in this situation.
I had problems, sorry, my wife had problems, and we used to go to the doctor off and on every 6 months. So he would advise to put some oil
Yeah,
and then come after 3 days and he will pump it out.
yes sir.
But sometimes the doctors are also scared if they pump too heavily,
Yeah,
it can damage.
that's why we're recommending that they put the drops, oil drops or wax dissolving drops, so the wax will be loose. So what happened, the drum is basically gonna be reflecting the water out and there's a certain angle. We cannot take it risk. So what happened, if the doctor is not able to remove the wax completely, he will tell you to come again, put some more wax or drops in the ear.
Okay, he also suggested to put olive oil once in a while.
Yeah, to make
White drops.
hydrated, to make it skin hydrated. It's like a moisturizer, right?
Yeah.
We need in winters we need moisturizer because sometimes what happens, because of dryness, you might get itchy ear. So that makes resolve that thing. So that's why he recommends. Yes, sir.
Is it useful to use the Q-tips?
I would say no. Don't use it. Don't use Q-tips. Yes, please.
Just a comment. When you put oil, the oil heated to the body temperature person.
No, no.
Just regular oil.
Normal temperature, do not heat the oil or anything. And it is not like you have to pour the oil, just 2 to 3 drops, that's
Yeah,
it.
2 to 3 drops.
But not warm oil.
37 degrees.
It might hurt your drum.
No, if it's done 37 degrees, our body temperature is completely safe.
That's fine, but not everyone is that much aware about it, to be honest. Mistakes happens, right?
I use it.
Well, I appreciate, thank you. Yes?
I think having the wax built up in the ear is but how often is it safe to have the wax removed?
Every 6 months you can see the doctor once you go for the animal. It's normal process. Yes, sir.
I think it's a natural lubrication. As I have read, there are several glands which secrete this wax.
Yeah.
So it's a natural phenomenon.
Yes.
So if we remove 100%, then it can cause damage.
No. As an audiologist, as per my studies, it is good to have a wax in the ear that it will act as a protective mechanism. There are some sebaceous glands which produce a wax. So what happens, once you remove the wax, it will again accumulate. But if it is over occluded, you cannot see the drum, so it means you have a partial hearing loss. Even if you have a partial wax, so we don't recommend to remove that all the time. There should be some wax because it's a kind of a soldiers which save your ear from the foreign bodies or any insects, basically.
I think number of times it is self-extraction. Your ear throws out the wax.
Yes,
Naturally.
that's
You generally don't need
yes.
to remove it.
We have a hair cells.
Actually, you don't need to remove it.
Yes, we have a hair cells like in ears, which are designed accordingly. That wax usually comes out, but if it is occluded, that's a condition.
If you go for a checkup for your hearing, then they recommend you, they will tell you, your wax build up there, you should go to your doctor, he will remove it. That's a party always do that.
Then I have related question. Lot of dryness in either or both ears. First, what causes it, and then what is the better solution or cure to it?
It depends on the skin. Everyone is different. Everyone is have a different skin. So yes. So dryness is basically for the winters. Basically, you will find like a dryness, right? So for the skin dryness, you put moisturizer. That's why if your ears get dry, you can put some olive oil, mineral oil, but in a very small amount to make sure your ears are hydrated, because it do need that thing. If it is a dryness, then it will be an itchy feeling for you, and it might attack some kind of infection rate also. So that's the recommendation.
There is one problem. I have grandkids, sometimes their mothers tell that while sleeping in the middle of the night, the child had problem.
Yes, sir.
Pain in the ear. What causes that?
So many reasons. Basically what happened with the babies, they might have tonsils. Because what happened, anatomical structures are different with the babies. Their canals are horizontal. So when they breastfeed or they eat or at that time, what happened, the station tube get plugged up, and they usually have a running nose. So it could create a negative pressure in the ear, and fluid accumulation is there, that's create a pain in the ear. So that is something like a very common thing for the babies. So that's why when the babies happen, so there will be a breastfeeding consultation for the lactation specialist. They usually tell how to feed the baby. Even if the baby is bottle feeding, you should focus on the position of the baby, because what happens, it might go to the ear also sometimes, negative pressure, and it can create an infection in that.
So sometimes they phone the hospital and they say, just take the baby or the kid outside in the balcony and he gets fresh air, and then...
Yeah, what happened at that time, why they're saying, because of the winters, they don't have like a sinus, they have like a congested ear, nose and sinuses. So it can lead to ear, nose and throat are interrelated. And that's why sometimes if they say go out with fresh air, they want to ventilate and take a fresh air so that the heaviness will go away in the babies.
You mentioned eustachian canal just now.
Station tube dysfunction, yeah.
What is the role of that balancing pressure behind the drum
Yes, sir.
towards deafness? Because I do find if I
Oh, yeah,
up my nose
yeah,
and go
yeah.
in, then I hear
Well, sir, it's just normal
Is
process.
there any way of cleaning up if there is a blockage in the station?
So see, this is a normal physiological changes. If you dive in, pressure increase. Because I told you the middle ear having a 3 bones, and this is completely hollow cavity. We need to equalize the pressure to make it a balance. So once we go up, pressure lowers, so station tube opens. Once you go down, pressure increase, station tube opens again to equalize the pressure. So the station tube do have a function on that. If you do like a puffing your nose, you're creating extra air pressure to release the middle ear pressure, and you feel like a popping. But it's a natural process. If there's any problem or pain, you have to consult with the doctor.
So do you have a process by which you can check whether your station?
Yes, we do have a test. We do have a test.
So, but that what I have seen in yes, and I do wear a hearing aid, that if I periodically have to go, as I said, pressurize the station, then also that I can hear better.
Yeah, so that is because of the psychological feeling, to be honest.
Psychological?
Yes. So what happened, not always, it's always built up kind of a thing. You will feel relaxed because change of pressure, dynamics, aerodynamics. It is something like habit, sometimes it's habit. For example, clearing throat.
But the result is that I hear better after.
That's what I'm telling you. You will feel like a psychological, yes, air is passed out, I can hear better. We do have a testing. If you have negative pressure, you have to consult with the doctor for the medication. But if there is a range of negative pressure, if you feel that some ears are very sensitive, some are not. So it depends. But it's not always that station tube dysfunction having like a fullness or this thing. Even if you have cold and cough, you will feel your ears are plugged. So that is also a condition. But after that, everything resolve it out within 2 days.
Okay, thanks.
Sure. So now, any other question?
Yeah.
You good?
Can you come up on tinnitus problem?
Yeah, we're gonna be taking
And
that
I mean,
part. Yeah, that
how to
topic.
explain it and what are the causes and
So
is
it's
there any recovery on it?
Yeah, I'm gonna cover that in the next presentation.
That's very important.
So yeah, we are just working step by step. So next thing is evidence of that hearing loss. So you will be finding amazed that diabetes and hearing loss are correlated. So there are some studies who shows that the people with diabetes are twice likely to have a hearing loss than a normal aging people. And diabetes is very common, specifically as per the 60 plus, it is more lifestyle issues, right? And whoever is a diabetes is more prone to get a hearing loss or any sensory deprivation. So it is always a good idea to have a regular checkup, whole body checkup. I would not say only for hearing, but eyesight, all the sense organs, because many studies have quoted that there's a correlation, direct correlation of diabetes with, with hearing loss. And pre-diabetic have a 30% higher rate of hearing loss those without diabetes. So you are 30% more prone to have a hearing loss if you have a diabetes. Now, there are some evidence-based research, and I also published some papers on it, that hearing loss and dementia are interrelated. So untreated hearing loss can lead to dementia, but not all dementia can lead to hearing loss. So this is something, hearing loss is one of the top risk factor. Untreated hearing loss is one of the risk factor which can cause dementia or cognitive impairment. And the psychological, physiological reason behind that is that I told you that your ears are connected to the brain with a nerve, and there is a part of auditory cortex which has received the signal. So what happened, and the motor area of the brain, which are responsible for the execution and the memory, is near to the auditory cortex. So if you have untreated hearing loss and your brain is not getting proper information as per the hearing of information, as time passes, the centers of that part will gonna stop function, and then it may lead to auditory deprivation, which can contribute more problem in cognitive and response delay. So you will be observing the patient or the person with a hearing loss are try to ignore the things. They don't, they don't take part in conversations. They feel like they have a memory problems. They feel like they want to sleep, right? Why? Because their brain is not active. So, if we find out there is a hearing loss and we are treating as soon as possible, if it is impacting your quality of life, it is always a good idea to have a treatment so that we can delay the process. Still, I'm saying we cannot stop aging, but we can still delay the process which can be happening because of any kind of a sensory deprivation. That could be visual, that could be hearing, that could be somatosensory or anything. A treated hearing loss can reduce the risk of dementia of 8%, and this is on study. Unfortunately, I don't have here screen, but I do have a research and I have a, kind of a pictograph. It shows the effect, because 8% generally contributes, like, if you have a hearing aid and you have a hearing loss and you're going for treatment and you're just using it continuously, so it will reduce the chances of that dementic features on kind of onset as early possible.
So in case you can give me the copy of your presentation, then I can circulate it.
To be honest, we cannot give you that. It's a
Oh,
copyright.
it's all right. It's all right. Perfectly all right.
Yeah.
Or any other research work,
Yeah, you can
which
search
be beneficial.
hearing loss with dementia. You will find so many articles.
Good. That's good.
You will just search in Google. You will get everything.
That's good.
Now, what is the importance of hearing? The other question. Oh yeah, sorry, we have the part.
So you can get the flyers from here.
Yes. I think you can distribute.
Sure.
Yes.
So I'm going to be continuing the presentation. Meanwhile, my associate is helping you guys. So hearing, why hearing is important? Can you tell me?
Because we can communicate.
Communicate.
We can live more.
You can live more.
Answer needed.
Very good. See, we are smiling. What's the difference between animals and humans? Animals and humans में क्या difference है?
So many things,
So many. But main thing is that expression. We are social. We are social. We can talk. We can express our feeling. We can communicate. Animals can communicate, but not verbally. They can do behaviorally. Right? But this is the best thing by the God, that we can communicate. And for the communication, hearing is very important. For example, ma'am, what's your name? And what's your name? Sorry? So आपने अपना नाम बताया, उनका नाम नहीं बताया, right? Why? Because you heard that, right? And you respond that. So this is how the process works. We take information, sensory information, and we respond to it. But if we have a hearing loss, you're gonna say, can you please repeat? I didn't get that. Right? I'm sorry, can you repeat? And if you're doing this again and again, you will feel that you're isolated from the conversation. And you try to ignore the process because you will feel, you know what? I always ask for people to repeat and then they make faces. And I don't want to be in that part. And that's how it impacts.
Does that hearing loss affect any singing?
Sorry?
Does that hearing loss affect any singing?
Yes, for sure. So hearing loss can affect your singing. There's a scientific reason for that. If you're a musical person, you know there are different notes in the music, right? So you cannot appreciate the music if you have a hearing loss. There are different notes, there are different melodies, different pitch level. And that's how it affects your hearing loss. Well, hearing, it connects with the family, hearing connects with the friends, sounds in our environment, music we love, and TV and radio.
I will circulate, please. I will circulate it.
So this is why hearing is very important. Hearing is also important for the safety purpose. If you're driving, if somebody's honking, you're not hearing, you might meet with an accident. While you're walking, there's some announcement going on, or some ambulance or fire car is coming, truck is coming, and you're not able to hear them, you might meet with an accident. Alarms and smoke, many seniors live alone. There's an alarm, and you cannot hear. It can lead to the danger in your life, right? Phone calls, you cannot connect with your loved ones. Because if you have a hearing loss, can you please repeat, I'm not getting it. Awaaz clear nahi aa raha. Like very common thing. This is very common thing. It means, yeah, there could be reason that, network is an issue, but not always.
What's the normal decibels for listening to the radio or the television?
It depends, psychological comfortability, and depends on the normal hearing range. So everyone is having different things, sir. It depends on the surrounding also, environment also. So many factors. Yes, please.
Yes, please.
Sorry, there is one question and then I'll take yours. Yes. For the hearing, yes. If it is medically by the doctors, after 85, I came across some of the clients of mine who have to go for the hearing test. If they have a hearing aids, they are okay. If they don't have, they have to surrender their license. So yes, you have a question?
If suppose the hearing loss is
and other people. And to be honest, let me tell you one thing, you have all children and grandchildren in your family. So the person who have hearing loss will not gonna realize that they have a hearing loss. The other family members will gonna tell them, why are you watching or listening or screaming loud? When you talk to them, sometimes seniors take it as in a personal ways. Why are you yelling at me? Don't try to do it again. But the problem is, when they're telling you in a polite manner, you're not able to hear.
No.
And you take it wrong sometimes.
No, that is there. What I say, suppose I am having normal hearing, as per my thinking, but because of wax, if it is clean, it is improved. Otherwise, due to aging, it is not making any effect on them.
So my answer will be, according to you have a normal hearing, everyone have, the person who have a hearing loss, they will also feel I have a normal hearing according to my age, but they are standards. So that's why we do the hearing test, and that's how we decide whether you need help or you have a normal hearing. So it totally depends on the professional advice, to be honest, because everyone will say, this hearing loss is not affecting thing. Once it is affecting you as to communication, it means it's more than 50%. So we have a limited outcome from the benefit of the device. No, thank you. All right, now I'm going to present 5 main reasons which makes you think to have a hearing test. First thing, people do not seem to speak clearly. In Canada, we are so lucky that we are so multicultural. Everyone have an accent. Some are from Russia, some are from Spain, some are French, some are English, some are Indians, some are Pakistanis, some are from South Asians. Everyone tries to speak differently. It's the beauty of this country. But sometimes we think that this people is not talking clearly. But that actually is a hearing issue sometimes. So if you feel that every third or fourth person is not speaking clearly, or the people are mumbling, then that's a condition. And it's a time to have a hearing test. There's no harm. If you have a normal hearing, again next year we do a hearing test, we're going to compare what's going on. But if there's any problem, we are here with a solution. What's happening over there? The second topmost reason is you have a difficulty time hearing when communicating with individual with hearing mass. So this is something after COVID, very prominent. What happened? Hearing is a secondary thing. So we do have a coping mechanism. We read lips. We guess what he said. But what happened during the lockdown and COVID time, we have a mask and the shield, then you don't have any cues to what this people is saying, the person is saying. So that is also a self-realization task. If you're not able to hear in the mask, the person is saying, what person is saying, it's a good time to have a task, hearing task. And there's no harm, it takes 20 minutes maximum if you have a normal hearing. But if you have a problem, then we have to do the complete assessment. Third thing, you have a ringing, buzzing, static, or any kind of a sound which are disturbing you, which is known as a tinnitus. We're going to discuss more about that. That is also mostly associated with hearing loss.
Is there a cure for that?
So depends what exactly is the reason for the tinnitus. So I'm going to discuss tinnitus more in depth. So I'll give you all the options and all the information about tinnitus. Turn up the volume or the television too loud for others. But that's what we told. You're watching TV, watching news, and your partner or your family members, your grandchildren saying, why are you keeping this too loud? So you feel, you know what, I hear on this level only. It's not loud for me. But that's what, you're not going to realize that this is loud for other people. So that is also reason where you should go for hearing test. At least you have a baseline. As a part of your overall health or wellness, it is required to have a hearing test. It will give you a satisfaction that yes, everything is going fine. Because every year you go for your eye testing, right? It will take 10 minutes. Same is for hearing test. It will take 15 minutes max to max if you have normal hearing. If you have a problem, we're going to be compared. How much is the deterioration? If you need a hearing aid, what kind of a benefit you're getting from that? If you need any medical referral or infection which can be controlled by surgeries or any medication, so we're going to be referring you to that. At least we're going to be having a solution somehow. So it's very important to have a hearing test. So any questions till now?
When you give a hearing aid to somebody, then how long it works and how often you have to change that hearing aid?
Perfect, very good question. That's the next slide of mine, but I'm going to be answering your question. So it depends on the loss, first of all. So we do have one of the best, everyone says we're going to be having a great technology of hearing aid, but really this is a really good time that after COVID, we have a really innovations in hearing industry. If you're going to be talking about old people, I'm talking about a generation before you, they were having a lots of issues with the hearing aid. They tell us this is too loud, I cannot hear properly, it's too big, it's squealing, it's very noisy. But now, we do have one of the advanced technologies of the devices in which those are myths for us. As an audiologist, I tell my clients, if they say that, oh, you know what, my grandfather used to tell this thing, I said that was a myth. Now we have a technology which focus on the clarity, focus on the noise reduction, focus on the clarity of the sound and comfortability like a normal hearing. Sorry, ma'am, you have a question?
She was asking if we want to make an appointment for her husband's hearing aid.
Yeah.
So I got the card.
Yes, so definitely I'm going to help you in that.
You call them. It's free. Can you tell people that they can book an appointment?
So today we are here to make an awareness about the hearing health. And as for this event, we do have a free hearing test for the people who belongs from this organization also. And after every 60, if you have any friends and family, you can also tell them to visit our clinic. We'll be providing free hearing tests and we'll be providing one of the best suggestions as per the recommendation needed. And we are fully fledged clinic. In case if you have any problems, we are there for you. We do have a vaccine removal, tinnitus management services and everything.
But is it not,
OHIP doesn't cover for the hearing test. No. Earlier they used to, but now no. Not even a vaccine removal. We do also provide service for the vaccine removal also. For the seniors, it's free. And if you refer someone, we will give additional discount, to be honest, right? Because health card will not going to be covered that thing also.
If you go to your family doctor, they charge for the vaccine.
Yes. ideally $60. It's a $60 for 2 years, but if you are coming from this event, it's free for you.
Your office won't be charging anything?
No, because of this event.
So can you tell how you charge?
For adults, for you after 60 is free. For seniors, it's free. Okay, now I'm going to be opening a discussion for the tinnitus.
Any appointment in case you want to have with them, they are here for the service. I have requested the organizers just to give us some more presentations to the same group and to the other group also. So they have agreed to it. They will be coming again. So I wish that all your problems pertaining to this must be solved, and I request you to give a good applause louder for a wonderful and very informative session. This was really very good. All the material which they are distributing, I will circulate it to you, to the group itself after scanning it. So you need not to worry for that and not to be in a hurry to get anything. So in case you want to have some appointment and discussion with them, this is. I have requested them to have one more session in the coming future.
No.
Thank you.
Hello everyone. Ankit will continue with the presentation. However, I would like you to enjoy the refreshments that we have provided. Also, the first 10 appointments that were going to be booked will get a gift today. And if you have more interested, you will receive a gift in the clinic when you come. Thank you.
So I'm going to be continuing the presentation, like, it's a talk and you can enjoy your refreshment also meanwhile. So now we're talking about the tinnitus or tinnitus. So tinnitus is a psychological condition sometimes, or it's a physiological perception of sound which is not present in environment. So there are so many theories and so many reasons for tinnitus. Mostly tinnitus is associated with hearing loss. So what happened, according to the physiological changes, aging process. So what exactly is the aging is like ears get, we have a dead regions in cochlea, that is the inner part. Like in aging, we see the wrinkles on our skin. So same thing, it affects the physiology. So in the ear, we have a dead regions because of aging process. So once the sound processing done in the inner ear, so that dead region, which is kind of a dead, they don't have stimulation because some special cells are related and nerves are innervated in the inner ear. So that dead region start vibrating and creating the sound, and that comes into the ear without any stimulation, and that's how we perceive the tinnitus. So this is actually a physiological, I would say, yes, physiological mechanism of tinnitus. If tinnitus is related to hearing loss, there are so many reasons, such as stress. Stress can lead to tinnitus. There are other medical conditions like blood pressure can lead to tinnitus. Spondylitis can lead to tinnitus. There's a TMJ, there's a temporomandibular joint problem in the tooth, can lead to tinnitus. So there are so many reasons. So that's why we have to find what exactly is the main cause of tinnitus. If we know that, we can treat it. So, as for the studies, it shows like, I would say 70% of tinnitus is related to hearing loss. So, if it is related to the hearing loss, we do have an option in our hearing aid, because if it is related to the wax or an infection, so it could be resolved by medication or surgery. But if it is related to the aging process hearing loss, like a sensory neural hearing loss with tinnitus, we do have a tinnitus masters that are a treatment in the hearing aid which help for the client to get rid of the tinnitus sound.
How do you identify the cause?
Sorry?
Can you identify the cause?
Depends. So as per objectively, we cannot, but subjectively, yes. If we know the reason, if the client will have a hearing loss more than, like if the high frequency hearing loss, most likely he's gonna be having a hearing loss, and then this is because of tinnitus, is also there because of the death issue. But if it is a hearing is normal, it might be related to the stress. If there's a blood pressure, it is related to the blood pressure also. So there are so many reasons. But if it is more related to the hearing loss, we can treat that. But if it is related to other things, it's hard. So other specialities, special professionals usually work on it, basically. Yes, yes. Yes, please, you have a question? Sorry? Vertigo balance. So it's also a very big topic. So many reasons. If you have I would say like our inner ear is having two functions, hearing and balance. If it is related to the hearing or your inner ear problem, we have to do the assessment for vertigo. So for the vertigo assessment, we have to run some tests to know if it is more related to that. Some of the clients who have a spondylitis or vitamin D problem, they do also have bone problem, less bone density, have a vertigo issues. Spondylitis, migraine have a vertigo problem. Some neurological disorders is having a vertigo chances. So we need to do a differential diagnosis, like a real assessment, to know why this vertigo is. If we know the reason, we have a treatment.
It has a different number, like the glasses.
So the hearing aid, yes, we do have a different types of hearing aids. Some are inside the ear, some are outside, some are behind the ear, some are invisible in the ear. So it depends on the severity. As I told you, the hearing loss is basically like a fingerprint. Everyone is having a different hearing sensitivity and different types of hearing loss. So it depends, and the eligibility is depends what kind of a loss is it, what kind of a quality assessment, what is your expectation, how is your lifestyle. So all questions, if we have answer, so then we're going to be recommending you the device. So there are so many reasons to selection for the devices. But we do have a rechargeable hearing aids with a Bluetooth technology, which is really good. So you can connect your phone with your hearing aid, you can stream music, you can adjust the volume through your phone.
ये चमन